The federal government is ramping up production of medical supplies like hand sanitizers, face masks, and ventilators to prepare for a growing number of coronavirus cases in Canada. Some auto manufacturing companies have even offered to retool their plants to produce these items instead. How soon can the government get this initiative off the ground? Deputy Prime Minister Chrystia Freeland joins me now from the foyer of the House of Commons. The government announced a plan to ramp up production of medical supplies like ventilators and face masks. How quickly can, for example, an auto parts plant retool to start producing ventilators?
You know, Joyce, that is something which is being explored even as we speak. I have to say, these are very worrying times. And something which has given me a lot of hope and inspiration this week has been seeing how Canadian companies, Canadian scientists have been just racing to volunteer to use all of their ingenuity and all of their skill to help our country overcome this challenge. It's very thrilling to me. I am really grateful. And we're lucky to be a country that still has a real manufacturing capacity, that still has great engineers and scientists. So they are working at it 24/7. I get just a million emails of people making offers. And the other thing to mention is we do also have companies like Thornhill Medical in my own riding, which are currently manufacturing ventilators. And those companies also who are making them today are ramping up their production.
Do we really have a clear picture of how many people have coronavirus if spouses of people with the virus aren't being tested or people without a travel history?
Some people without travel histories are being tested. Dr. Tam has been very clear about how we are testing the more high-risk groups. That includes people who are in hospital with some sort of a respiratory illness. It includes any medical worker who shows any signs of symptoms. And one of the things that's worth really explaining is the value of testing is so that we can do tracing. And so that's why it's really important to test the most high-risk communities first so that all the people who do the tracing, which is both very important and very labor-intensive, can be deployed to trace where we find people. Having said that, Canada for sure is ramping up testing, and we are testing a lot, and that's a good thing.
But do we have enough test kits, enough lab technicians?
To both, I would say yes and yes. And I would also say how we need to think about this is we need to be looking to the future and looking to the need to develop surge capacity. What all of the experts are saying is this is going to get worse before it gets better. All of us, and I am so impressed by the efforts I've seen from all Canadians this week. People really are practicing social distancing. People are working hard to keep themselves and their neighbors healthy and safe. And that will help. It will help us to flatten the curve. But even if we all do our best, which we are, it is going to get worse before it gets better. And so for us, and we had a long discussion in cabinet committee, many discussions actually this week around what we are doing to be sure that we have surge capacity in Canada. And that means we need the ventilators, we need the test kits, we need the protective equipment for all of the medical workers. It also means we need medical personnel. Another thing that we need to be able to do, and I have to say, I am just so grateful to see the level of collaboration across the country, is an ability to be prepared as necessary to move resources across the country where we need to do that. I also really want to say what a fantastic job provincial leadership, premiers of provinces and territories across the country are doing. We are seeing a lot of them prepare provincial medical systems for that potential surge. And that has meant taking some difficult decisions, like saying to people, you can't have your elective surgery. That is real leadership. and I'm very grateful.
So one of the biggest challenges in this crisis is weighing the economy and people's health. Your government has pledged $82 billion in aid. 55 billion of that is tax deferrals. Only 27 billion is for direct aid to businesses and individuals. Is that really enough, or is this just the beginning?
Well, first of all, Joyce, I would say that businesses feel not having to pay tax right away is a real source of support, and I've heard from a lot of businesses who see that as a very positive step. There has also been a lot of liquidity support from our government, from the Bank of Canada, and that is really important too. The $27 billion is mostly direct money to go directly into the pockets of Canadians who either have lost their jobs or can't go to work because they are self-isolating, or they are caring for someone who is self-isolating, or, as many parents are experiencing, they need to take care of a child who can't be in school. So that is very important, very valuable. Is this just a first step? Look, Joyce, I think no one has a crystal ball, but we do know that this virus is going to get worse before it gets better, and that suggests that the economic, that we are not at the end of the economic impact. What I will say is our government is absolutely ready and prepared to do whatever it takes to keep our economy strong. You know, the metaphor I use a little bit is it's like weathering the storm. Because as you point out, there's a little bit of a paradox here, that to fight the virus, to keep Canadians healthy and safe, what we need to do actually is shut things down, right? We are giving people advice which tends to lead to a decrease in economic activity, and that's what we have to do, and I know people understand that and support it. So what we need to do is get through that period and then be in a position so that the Canadian economy can come roaring back when we are through that period, and I am confident we can do it.
Your government made the decision last week to close the Canada-US border. Like, why now? Why did it take so long to decide to close the border? You said it was because of trade and the supply chain, but now you found a solution. So why couldn't this have been done, for instance, weeks ago?
So first of all, Joyce, please don't call it closing the Canada-US border. We are very emphatic that this is about restricting non-essential travel. This is about saying to people, now is not the time to make a tourist trip. Now is not the time to cross the border for recreation. And it's a very important distinction because the lives of so many Canadians and Americans require frequent border crossing. I mean, our grocery stores would run out of food without those trade flows, so would our drugstores. So it is very important to be clear, this is about restricting non-essential travel, but being sure that trade continues unimpeded and all the essential travel continues unimpeded. Why did it take so long? Well, look, I would challenge the premise of that question, that it took a long time. But I 100% would, defend for hours, if you would listen to me that long, being careful and taking care to reach an arrangement with the Canada-US border which was reciprocal and collaborative with the United States. And the reason for that is it was so important for us to achieve two things at the same time. That we restrict the non-essential travel, but we keep the trade flows going. So there was a certain delicacy to managing that, and I am really, really, frankly relieved that we have done that. And I do want to really thank our American neighbors for being great partners in sorting this out.
Thank you, Deputy Prime Minister Chrystia Freeland. I know you're very busy. I hope you get to go home and see your children.
I hope to see them one day again also, Joyce. Thank you very much.